morning or good afternoon, Ma'am Karen Mirafantas. I am Chris Carlo L. Rabaya from BSN 4I, and today I will be return demonstrating the immediate newborn care. So first, NBC or immediate newborn care are activities that will prevent the occurrence of untoward effect in the newborn, including hypothermia, infection, and bleeding. So, by performing newborn care, this is also to prevent bleeding from the cord, infection of the cord, and also the eye of the newborn, and lastly, preventing hypothermia. So, first thing that I'm going to do is I will disinfect and prepare the crib before the delivery of the newborn. So, mani ang crib, ang working area. So, first is supposedly na ilimpyo na nako. I'm cleaning the crib, and next to that is I'm now going to prepare 2 drop lights. So, the reason for having drop lights is to warm the baby, and this is my drop light. Assuming this is my drop light, and I have only one, but I will mention it needs to be 2 drop lights. So here and here. Then next to that is I am now going to assemble all the equipments needed for the newborn care procedure. So first is the layout. So I'm going to divide the table. So this is where I'm going to put the baby later, and this is where my equipments are. And because I am also right-handed. Limited ang table. Tutuon lang ako siya for now because the space of my table is study table is limited. Then next to that is the patient's or the newborn's gown, the bootens, the booties, the mittens, the diaper, and the extra layette for changing later. Then after that, after preparing and assembling the equipments, now I'm going to perform medical hand washing. So assuming I am done performing my medical hand washing, I am now going to disinfect my hand with alcohol or sanitizer. So in my case, I have alcohol only. So next to this is I'm now going to prepare my kidney basin as waste receptacle. So kidney basin as my waste receptacle. Then after that, I am now going to prepare my hypo tray. Balik sa ako para makita. Visible. Okay. So first, I have here my 4 cotton balls. So in my case, I have added more than 4 cotton balls here. 4 siya because specifically 2 dry cotton balls and 2 soaked with alcohol. Then next we have the tape measure for for measuring the length, or use the anthropometric measure later for the newborn. And next we have the vitamin K ampule. Then next we have the eye ointment, or the teramycin, the kids prophylaxis, and the vitamin K, or the phytomenadione. Then next to that we have the tuberculin syringe. Then 2 thermometer. So ma'am, ballpen mo lang po, Muji pens ang thermometer ko po, because nawala yung thermometer namin dito sa bahay, and also my thermometer. So next to this is I'm now going to prepare the medicine. So starting off sa teramycin. My teramycin, or my Creed's prophylaxis. This is used for the newborn, and it will be placed under the eyelid, the inner canthus of the newborn, to prevent ophthalmia neonatorium, or in the layman's term, blindness, baby's blindness. Then for us to check, for us to make sure that this is the correct medication, we have to read the name of the drug. So name of the drug, teramycin. Then after reading the name of the drug, we have to check the manufacturing. We have to check the manufacturing and the expiry date of the drug before administering it to the patient, to the newborn, and check also the dosage and the characteristics of the drug. So after checking, reading and getting the expiry date, manufacturing date, and the dosage of the drug or the ointment, I'm now going to put this on my hypo tray. And then next is my vitamin K, or my phytomenadione. So first, here is I'm going to disinfect my vitamin K ampule. With cotton balls soaked with alcohol. Put it on the hypo tray, and then put the used cotton ball soaked with alcohol in my waste receptacle. Then get the so in getting the vitamin K, I'm going to read the name again, and expiration date, and the dosage. Then after that, I am now going to get another dry cotton ball and place it on the neck of the ampule, and make sure that before breaking it, the dot is facing towards me, or in the opposite side. Nasa diri sa likod nako, facing sa kuha. Then cover the neck with cotton balls, and then break it. So assuming na break nako, so tsak. Then tsak. After breaking it, place it on the hypo tray, carefully, not spilling it, and then the head part, or the broken part, the sharp container, the sharp part of the vitamin K ampule is now going to be placed on my sharps container. So this is my sharps container. So after breaking it, I'm now going to get my tuberculin syringe. throw the cover, the receptacle, waste receptacle, and then lock it, and then un what you call this, tanggalan na to, i-remove na to ang cap sa syringe using only one hand, because the one hand is holding the vitamin K ampule. So remove it, then after that, before aspirating, dapat careful ka and tumbahon mo siya, tilt the vitamin K ampule, tilt the ampule, and then just the needle i-place nimo sa sulod, and pwede nimo siya i-tilt, dili ka dapat mabalaka kay it will not spill even though imo pa na siyang i-upside down ang ampule. So get 0 for the what do you call this, so for the vitamin K, so full term neonates is 0.1 cc, and for the preterm neonate it is 0.05 cc, and will be intramuscularly injected at the left thigh vastus lateralis. So in my case, so assuming that our baby is full term, so I'm going to get 0.1 cc. 0.1 cc. So place it back again in the hypo tray, and then make sure that the bubbles, or if there are bubbles, eliminate the bubbles, and make sure that all is left, all that is inside the syringe is only the phytomenadione, or the drug. Assuming that. So balik ko na sa cup. Then the vitamin K ampule, or the ampule, will be thrown in the sharps container. Sharps container. So now I have ready na and before using the crates prophylaxis, I have also to wash it with cotton ball soap with alcohol. Throw it on the waste receptacle. Then after that, after preparing the medication tray and my hypo tray, so balik to sa ko ang gown diri, patient's gown, and my hypo tray, and I also have the stethoscope, but kanina stethoscope is not advisable because my stethoscope for the newborn, and this is the only stethoscope I have na kayong pang ward duty po, ma'am. So this will be used in today's return demonstration. Then I also have my working gloves. So after preparing the medication, I am going to wash my hands again, medical hand washing. So that, assuming that I am done with my medical hand washing, I am now going again to put or disinfect my hands with alcohol. And also, ma'am, I forgot to show my comb, ma'am. Comb and the girdle. Girdle ba na, ma'am? Or yung pang restrain ng baby po later. So next, now I'm going to don my gloves or my working gloves. So after donning my gloves, I am now the crib is ready. My workplace is ready, and all the assemble on all the equipments are ready to be used. And now I'm going to, for now, I will be waiting for the baby to be delivered to me. And assuming na ang baby na here, the baby is here. Ito. So thank you, nurse or doc, nurse. So upon receiving the newborn, na weigh na siya ng no need na for me to weigh the weight of the baby because it is being weighed by the pediatrician already. So for the newborns, for the newborns weight, ma'am, the normal range is 2.5 to 3.5 kilograms. So thank you. Then I will, as nurses, it is our job to document the weight of the baby. So later I will explain. So sit na baby. So upon receiving the baby, handle it gently or with care. Support the head part. Place the baby here and place the used layette on the hamper. So next to that, upon receiving the baby, or the newborn, I have to check the ID band, make sure that this is the baby. So now I'm going to check the ID band. Okay, and after checking the ID band, I am now going to check for bruises gently or deformities. So then count the fingers, check if it is complete, the toes. So okay siya, and be careful because not to bruise the baby, or handle it very gently because the baby is very soft, is very delicate because he or she is still a newborn. Then after that, I am now going to take the first part or the first vital signs for full 1 minute of the baby. Vital signs for full 1 minute of the baby. So this is the first part of taking the vital signs. So first, I am now going to get the respiratory rate of the baby. In taking the respiratory rate, I'm going to place my hand over the chest and feel for the rise and fall of the chest of the baby, and then count it. So for full 1 minute. Assuming that I am done counting the respiratory rate of the baby in ano po 1 minute. So the normal value of respiratory rate for the baby is 40 to 60 cycles per minute. So assuming it is 45 cycles per minute. So after that, I am now going to get the cardiac rate of the baby. So I'm now going to use my stethoscope. So before getting the cardiac rate of the baby, I am going to warm first the diaphragm for the baby not to be shocked or cry if it feels certain coldness in the diaphragm. So after warming, I can place it on the chest na. So place it just gently, because basin mo lakra siya, and there are tendencies na if ever dili ka gentle in handling the baby na maglakra and under your care, so pwede ka napaka-chance na makasuhan or mag-complain ang parents. So you have to be careful. So just gently apply light pressure and then count for the cardiac rate in full 1 minute. And so for the cardiac rate, the normal values for the cardiac rate is 120 to 160 beats per minute. So assuming that the baby is 130 beats per minute. So and in documenting pala po, ma'am, na I have an assistant or other nurse na that will student nurse or that will document my vital signs and the anthropometric measures, ma'am, in the jot down notebook. So first pala, ma'am, in what I'm going to write in my jot down notebook is the name of institution, name of the patient, its gender, and wala pa man na name, so family name. Then after that, name of the mother. Then also we have to write the date of delivery, and lastly the time of the delivery. So ganyan. And for the third and final taking of my vital signs, I am now going to take the temperature of the baby. So here is my temperature, thermometer. Then before injecting it, it is made sure that the last part is taking the rectal temperature of the baby, because the rationale for this is if the rectal temperature is taken first, the baby might cry, and after getting that temperature and proceeding to the heart, to the cardiac rate and the respiratory rate, the values or the vital signs of the baby is not normal anymore, because the baby is or was crying due to taking the rectal temperature. So make sure that this is the last part in taking the vital signs. So also in taking the rectal temperature, make sure that it is only up to the bulb, and so pasulod, and before putting it, gently open you call this hold the two legs of the baby and find the anus of the baby, and then in a twisting motion slowly push it. Then then wait for it to beep, and And the rationale for also the reason for getting the rectal temperature is to check for the if the baby has perforated anus. So after checking the temperature of the baby, the normal temperature for the appropriate gestation age or the AGA is 36.5 degrees Celsius to 37.5 degrees Celsius. And if it is premature, it is 35.5 degrees Celsius to 36.5 degrees Celsius. So after that, I'm now going to place my used thermometer in the waist receptacle. So after getting the first part of the vital sign, I'm now going to take the anthropometric measurement. So I'm now going to get my measuring tape, and for the first part in getting the anthropometric measurement, I am now going first is the head circumference. So for the head circumference, I have the what do you call this? The tape measure should be is placed in the lower border and must be in the line sa eyebrow sa baby and the tip sa iyang ears po. So and also using it sa kaning dili ning inch na measurement kung dili the centimeter. So slowly place the newborn carefully to its side para masulod ang tape measure. And then down, then here. So tip sa eyebrow, and then measure it accurately. So assuming na normal baby po siya, ma'am, so the head circumference is 34, whereas the normal values of the head circumference is 33 to 35 centimeters po. And next to that, we are now going to proceed to the chest circumference. So first is place the tape measure on the line or in line with the nipple here. So ma'am, place gently. Always remember to handle the newborn with care. So, nasa nipple sa baby. So, in measuring it, so assuming that I am done measuring my actual baby, the chest circumference is 32, whereas the normal values of the chest circumference is 31 to 33 centimeters. Then next to that, we have the abdominal circumference. Just lower the tape measure to the abdominal part of the baby, and for the abdominal part, place it just next to the ma'am, you call this, there is a pusod sa navel sa umbilical cord. Place it just next to the umbilical cord, your tape measure slowly, and record it. So for my measurement, so my baby is 30 centimeters, whereas the normal values of the abdominal circumference is 30 to 32 centimeters po. So that check na sa my assistant or my co-student nurse is recording it in my jot down notebook. After that, I am now going to take the measurement of the length. So in the length, I have to start at the bottom, or the start at the heel. So in measuring the length of the newborn mom, I'm going to start to the heel sa baby and to the vertex of the head. So pwede mo siya kuha mo siya in order to get precise measurement of the baby. You have to patakilid siya, ma'am, then carefully place the tape measure on the heel of the foot of the baby, and you can slowly stretch it a little bit ang iyang mga parts sa legs. Then at the vertex of the head, so ito po, ma'am. So if you're done and sure that this is the measurement and the vertex of the head, so you can now, in order the baby to be comfortable and not to cry and to prevent injuries or disgrasya, we can now let go of the tape measure from the bottom part, and do not let go of the upper part, and place the baby back comfortably and gently. So in my measurement sa length, it is 43 centimeters po. So sa length, the normal circumference of the length is 48.5 to 53.75 centimeters. So sa kung case kay dili normal ang baby, pero mauto ako ang na measure. So after taking and recording the anthropometric measurement of the newborn, I am now going to place my tape measure on the waist receptacle, because it is done using place it on the waist receptacle, kidney basin. Then next to that, I will now going to proceed to restrain the newborn from the upper extremity, restrain its upper and lower extremities for the next procedure. So naka-fold man ni ato ang layet, so I'm going to unfold it. To securely restrain the newborn. So restrain it first sa hands, upper extremities, fold, and ipit sa iyahang hands carefully, and then the excess part is tuck diri sa sa likod sa newborn. Slowly lift it and tuck it. Okay, and also the other side, get and tuck it. Make sure na dili kayo hugot. Okay, and for the lower extremities, I have my ikot, ma'am, or I forgot the name, ma'am. So in restraining the lower extremities, ma'am, first place it on the knee part of the baby and cross it over and to the top, and make a tie and tie it, not untie it. So tie it, not too loose and not too tight, in order for us to not stop the circulation of the blood from the lower extremities po. So So after restraining the baby, I am now going to get my cridge prophylaxis and apply it. So first, open it. So assuming ma'am di mo gud ni siya gyud cridge prophylaxis, this is BL cream. So first is mag discard na to ang first uh, first juice first excess. So magpagawas ta, then i-discard na to pa. Then we can now apply it sa eye sa baby, starting from the inner canthus down to the outer canthus of the eye of the baby. And the reason for this is to prevent neonatal blindness. So slowly lang, in order to slowly, gently handle the baby, because in order for it to prevent from crying, kay lisod na if magsigi na og hilak ang baby and nagsigi og piyong, kay lisod na pod kung bulikato na to iyahang eyes. So slowly and medyo apply ka light force, light pressure, then apply it from inner to outer canthus. Then same sa other side, inner to outer canthus. Then next is close it. After closing it, put it back on the hypo tray, and now I am going to proceed to the lower extremities, wherein I will now administer my phytomenadione drug, or my vitamin K sa baby. Now I'm going to get 1 cotton ball soaked with alcohol, and now I'm going to disinfect the site for intramuscular injection. So inner, starting from circular motion from inner to outer. Oh, and wait lang mama, then after disinfecting it, let it dry and put this on the waste receptacle, and before pud mag-apply sa mag-administer sa drug intramuscularly, we have to know its location. So this is the anterior part of the lower extremity, and this is the lateral part. So we have to administer it sa middle, and divide the legs in 3 parts. So in dividing the legs in 3 parts, so upper third, so first, middle third, and we have the lower third. So asa na to i-administer? Diri sa middle third. Tama ko. Yes. Sa middle third. And then get cotton balls again, dry cotton balls, and place it here para mao ang ibutang na to after injecting it. And before administering it, I'm going to put the heel of my palm into the baby's knee. And never forget na light pressure lang dapat, and do the cushion fashion. Here, slowly. So I am 90 degrees, and next is inject na nato. So tusok. After matusok, we have to check. We have to what do you call this? Inject, then support the hub, and then aspirate to check if there's blood. Kaya kasi nakaigot ang blood vessel. So if there is none, pag aspirate, okay, you can proceed to administering it. So administer, then box hypo tray, and tabunan na pod balik ang syringe, and then press the site. Do not rub it. And ano lang pod, light pressure lang. So after that, after administering my medications, throw it on the cotton balls, throw it on the waist receptacle, and release the restraints from the patient sa upper and lower extremities slowly. So never forget to handle the baby slowly always. So throw the restraints in the waist receptacle and slowly the baby. Handle the baby with care as always, as usual. So next to that, I'm now going to take the second part of my vital signs, which is the first is the respiratory rate. So here gapon. So is a respiratory rate today, ma'am. I have to check also the retraction. So you call it the meaning of retraction is the chest and the abdomen. Ano po, the rise and fall of the chest and the abdomen is the simultaneous po sila. That is the retraction. So after getting it, after getting the respiratory rate, it is 45 cycles per minute. So recorded sa ako ang student, sa ako ang partner or student, co-student nurse. Then after that, get the cardiac rate using my stethoscope, and never forget again to warm the stethoscope. Warm the diaphragm before placing it on the chest, and with a light pressure. So after getting the chest, the cardiac rate, which is 130 beats per minute, that is normal. Record sa ating assistant. Then next we will now take, I am now going to take the temperature, which is sa axilla na po, axilla. So pisliton it, then ipit, then sa vital signs, sa temperature, so wait, so 37 degrees Celsius, which is normal for the AGA, AGA. Then throw it in the waist receptacle na. Then next is I'm now going to cleanse the newborn using the comb. Using the towel, kaning towel, pwede na siya. Because the baby is filled with vaginal discharges sa mama, because it has been through the birth canal, the vagina of the mommy. So support the head part, then slowly comb the discharges. Ano ko ma'am, kay pilit siya. Slowly, baby, para dili mag-cry. Okay. Then once I am done, I'm now slowly put the baby, lay the baby back. And once I am done filling the discharges, I'm now going to place my comb sa waist receptacle. And now for the next part, I am now going to dress the newborn. So first, I am going to is change the layette. So in changing the layette, I'm going to wrap the baby slowly, then on the layette, if it's a hamper or hamper, and get the new layette. put the baby back sa yung new layet. And then proceed now to the to put the baby's bonnet on the head. Clean bonnet. So slowly put it sa baby's head. Medyo huot sa kuha ma'am, sa kuha ang baby. Medyo big yung ulo. That's okay. Na. The next is the bonnet. The next is put the newborn's gown, which is the sterile gown. Why sterile? Because isa sa reason na sterile ang gown na to, because para dili ma infected ang you call this the umbilical cord sa baby, kaya di ba naka-attach pa siya. So wrap it slowly first before pushing it sa hands, kay make sure that the hands is baliktad. The hands are in a fist position para close, para iwas madanggal or masangit ang cute na mga fingers sa baby. Na slowly lang. Then pakilid ang baby para ano sa tika side na side. And then for the other arm again, make sure that na maka-fist position Japon to avoid injuries sa baby. Okay, put it and then tie it. Excuse me. Oh, hindi mo ako pumunta. Ano pala eh? Then next it is upper part. Tie them. Okay, last part. Then wait lang. Then after when you are done the patient's gown, we can now proceed to the putting the patient's diaper. So carefully, so asawa ko sa mama para makita, carefully tuck the gown diri pataas para dili masangit and maipit sa diaper later. So here is my diaper, naka-strap, dili tong murag panty. So in putting on the diaper, we have to be sure that the cord is on top of the diaper. Oh my god, this is my first time. So lift the baby. This diaper. Okay. Oh. Then that. Then lock it. Make sure that the umbilical cord is on top of the diaper. Dili siya mabutang sa inside the diaper, because the discharge of the urine is very critical. Dilit. Ha? Ano dito? Okay. I think I'm done with putting the diaper. And now I'm going to get the mittens. It's hands a baby, and before placing it, you have to make check it sa sulod if there are excess threads that will injure or wound the baby. So make sure wala. So in my case, wala. Mittens are clean inside and out. And slowly make a fist, make the fist ang hand sa baby para diretso sulod and dili madanggal, dili magkasakit ang baby. Then tie it. Okay, next part, next hand, and same as usual, same, check if there are excess threads, and before entering it, make sure that the hands are in a fist position. Tit na baby, tit na mamunan. Okay, and proceed sa booties. Same, check if there are excess threads and slowly put it on. Slowly. Then tie it. And the other part or sides of it, check if there are excess threads and there are none, and then slowly put it on and tie it. Then next to that, after I'm done changing or clothing my baby, dressing my newborn, I'm now going to swaddle the baby. So first, in swaddling the baby, cover the head part there, and then ipit dali ang hands, and then proceed to this side. And after that, dali ka sa baba mag-start sa bottom part. And don't tuck it on the side. And then hello ka. And then that, and then very slowly. Okay. Wala lang sa baby nga naka-wrap. Naka-wrap siya. Naka-wrap siya mama na. And dili siya maabot na diri ma'am. Wait lang mama. Tuck it. Hala. Abot ng tugod sa practice. Tuck the excess part. Okay, I'm done swaddling the baby. Baby is now comfortable. So after swaddling the baby, place it sa iyang crib na naka naka ano po ma'am, naka elevate ang head part always. So then patama na ko ang baby rin, elevate head part, thumbs. So after I'm done with the immediate newborn care return demonstration, I am now going to do the aftercare. And first is throw or dispose the sharps container. Dispose the sharps in my sharps container. Pull them up here. Then the extra syringe, put it on the waist receptacle. Ilabay na sila later. Then the tape measure, the stethoscope, the comb, the thermometers will be ma-wipe ni siya kay magamiton pa ni sa later na the taking of vital signs sa baby. And the other instruments will be soaked for 30 minutes in the disinfectant solution, then i-rinse na to. And then after rinsing, we have to dry the instruments that are used and clean na. Then after we are done with the aftercare, after we are done with our aftercare, we can now do the documentation. So the documentation po ma'am, for the documentation, so first is where the questions are where to document. So first we have the patient's chart, and in the patient's chart we have the vital signs sheet and the medication sheet, and we also have the medication notebook provided sa NICU for the SPH settings. Then after that, after the documentation, the last part is monitor vital signs every 15 minutes until stable. If unstable ang patient na newborn, and then every 30 minutes in 4 takes. So that is all for my return demonstration and immediate newborn care po ma'am. Thank you po.